afternoon. I am Dr. K. Vijaykumar. I am a physician and diabetologist from Bangalore. I am the Honorary Secretary for the Karnataka State RSSDI chapter. Today I want to speak about the diabetes and the cardiovascular relation to diabetes. Diabetes, any person who is diagnosed, it is thought to be equivalent to coronary artery disease. However, now it is learnt that diabetes definitely increases the risk of cardiovascular diseases, but we cannot say it is really equivalent to cardiovascular disease at this moment compared to a person who is already had an event of MI or a heart attack. What we are worried about in diabetes is, and its relation to the heart, is eventually the person who is having diabetes can develop a heart disease directly because of diabetes or the hyperglycemic status. The cardiovascular disease that actually is worrying in a diabetes patient is the heart failure. Heart failure can occur as early in the disease progression, and it should be dealt with as early as possible. Cardiovascular events can eventually happen if not having a good glycemic control. The cardiovascular risk can be reduced by multiple ways. The first challenge in dealing with the cardiovascular disease is from the patient side, that the patient not controlling the glycemia adequately, and from the physician inertia also contributing to the states. And the health system also can be a major role in preventing cardiovascular diseases. Cardiovascular disease can be reduced, or the risk reduction is basically by multifactorial. Firstly, the patient discipline in controlling the glycemia. Then the patient is put on adequate therapeutic agents that would basically focus on reducing the cardiovascular risk. And there are quite a good molecules that has shown, and evidence has been established by, for example, the SGLT2 inhibitors and the GLP-1 analogs, which has shown largely a CV benefit, not just the cardiovascular risk reduction. So cardiovascular CV or the cardiovascular benefit benefiting molecules like the SGLT2 and the GLP-1 analogs can be started early in the disease progression, so that the risk reduction is largely attained. So with this note, I would want to summarize that cardiovascular disease risk reduction is the major role in treating any diabetes patient. Thank you.